Welcome. Today we will talk about Terbisil Cream medicine. Terbisil Cream Terbinafine HCIBP 1% is up. Specs medicine. Terbisil Cream has a rapid onset of action and can be effective with a short treatment duration. Terbinafine is an allylamine that has a broad spectrum of antifungal activity. In fungal infections of the skin caused by dermatophytes such as Trichophyton Microspore Canis and Epidermophyton floccose. Package contains. Each pack of Terbisil contains 15 grams cream tube and a leaflet. The cream is also available in 10 and 30 grams. It is also available as a lotion. Composition. Each gram contains Terbinafine HCIBP 1% with W product complies with JP. Specs. Dosage and administration, as directed by the physician. For indications and other information see enclosed leaflet. Dosage and application. The duration of treatment varies according to the indication and the severity of the infection. The cream can be applied once or twice daily. Cleanse and dry the affected areas thoroughly before treating with the cream. Apply the cream to the affected skin and surrounding area in a thin layer and rub it lightly. In the case of intertriginous infections, submammary, interdigital, intergluteal, inguinal, the application may be covered with gauze, woven cotton bandage, especially at night. Likely duration of treatment. Tinea corporis, T. cruris and Tinea pedis, 1 week once a day. Cutaneous candidiasis, 1 week, once a day. Pityriasis versicolor, 1 week twice a day. If there are no signs of improvement after 2 weeks, the diagnosis should be verified. Therapeutic indications. Fungal infections of the skin caused by dermatophytes. Pityriasis, tinea, versicolor. Yeast infections of the skin. Principally those caused by the genus Candida, e.g. Candida albicans. Contraindications, known. Hypersensitivity to terbinafine or any of the excipients contained in the formulation. Special warnings and special precautions for use. Terbisil cream is for external use only. It may be irritating to the eyes. In the case of accidental contact with the eyes, rinse the eyes thoroughly with running water. Terbisil cream, like all medicines, should be kept out of the reach of children. Pregnancy and lactation. Animal studies did not reveal any teratogenic or embryo fetotoxic potential of terbinafine. No case of malformations in humans has been reported with Terbisil to date. However, since clinical experience in pregnant women is very limited, topical Terbisil should be used only if clearly indicated during pregnancy. With the treatment of Terbisil cream, the small amounts absorbed through skin and unlikely to affect the infant. Nursing mothers should not apply Terbisil cream lotion to the breast. Adverse effects. If Terbisil cream ingested inadvertently, adverse effects similar to those observed with an overdosage of Terbisil tablets, e.g. headache, nausea, epigastric pain and dizziness, are to be expected. Instructions. Store between 15 degrees Celsius to 30 degrees Celsius. Protect from light. Keep out of the reach of children. To be sold by prescription only. For external use only. Manufacturer and buy online. Terbisil cream is manufactured by Saffron Pharmaceuticals, PVT, Ltd. It is available online, or you can buy it from any nearby pharmacy. It is available at retail price around 330 rupees. This video is for educational purposes. Take every medicine as your doctor or pharmacist prescribes it.